Hello everyone, this is Mark. This is Farah Igi, and I'm interviewing or recording a video about mock interview. Okay, so reflection. When working with Isabel, a helper will need to demonstrate strong active listening skills. This means not just hearing her words, but truly understanding the underlying emotions and concerns. For instance, when she talks about her heart racing and chest hurting, a helper will listen for the anxiety and fear associated with these physical symptoms. Empathy will be crucial in validating her feelings of stress from both work and home, making her feel understood and less alone. The helper will likely use open-ended questions to encourage Isabel to elaborate on her experience, such as asking, can you tell me more about what makes your work environment so high stress? Or how have you noticed your children become more withdrawn? Furthermore, nonverbal communication skills will be important. Maintaining eye contact, nodding, and having an open posture will convey at- attentiveness and warmth. The helper also need to practice cultural sensitivity, recognize Isabel Latina heritage, and consider how cultural factors might influence her perceptions of stress, family, and help seeking. The ability to build a rapport quickly will be essential, giving Isabel voluntary decision to seek services. Finally, assessment skills will be at play as the helper gathers information to understand the scope of Isabel in anxiety, focus issues, and self-esteem concerns, and how these interrelate with her family and work life. This comprehensive approach will lay the foundation for effective intervention. So, current Isabel, age 33, all demographics, Latina female presenting concerns, anxiety problems, focusing low esteem, doesn't feel good about herself, stress from work, high stress environment, missing deadlines, stress from home life, divorced, stranger from children, his father, strained relationship with parents, um, physical symptoms, heart racing, chest hurts, attributed to stress family situation, divorced with two children, estranged from the children's father, due full custody of her children, strained relationship with her parents, led to not attend church, concerned about her children's withdrawal and disruptive behavior, attributing it to the absence of their father and grandparents. Social spiritual beliefs in God but has not attended church recently due to disagreement with her parents. Reason for seeking services: voluntarily seeking counseling due to combined stress of her work and home life. Summary of Isabel's situation: Isabel is a 32 years old Latina woman voluntarily speaking counseling due to significant stress stemming from both her demanding career as a project manager and complex family dynamics. She is experiencing anxiety, difficulty concentrating, and low self-esteem, which are manifesting physically with symptoms like heart racing and chest pain. As divorced mother with full custody of her two children, she faces challenges with estrangement from children's father and strained relationship with her own parents. She worries that these family circumstances are negatively impacting her children's behavior. Her spiritual life is also affected by parental estrangement. Okay, so psychosocial assessment, biopsychosocial assessment. So current name Isabel, Dub 1993, January 5th, start time 1:08 p.m. Date 12:08:25, age 32 years old, and in time 6 p.m. So identifying information. Isabel is a 32 of age and born 1993. Present problem is Isabel is 32 years old Latina female voluntarily seeking counseling. Her present problems include experiencing anxiety, difficult focusing, and low self-esteem. These issues are exacerbated by her demanding job as a project manager in high-stress environment, where she has been missing deadlines. This work-related stress has led to physical symptoms such as racing heart and chest pain. On a personal level, Isabel is divorced and has a full custody of her two children. She is estranged from children's father due to her religious practice, which involves belief in God, has been impacted by her disagreement with her parents, causing her to case attending church. Isabel is concerned about her children who has observed becoming more withdrawn and occasionally disruptive. She believes this behavior stems from the absence of their father and her parents. The cumulative stress from both her work and home life is primarily reason she has sought assistance from the agency. Isabel reports no history of substance use, no self-reported history of substance use addiction. This is important as rules out substance-related issues primarily contributing on her current symptoms. Isabel experience complex interplay work-related is the addictionist. Isabel experiencing complex interplay of work-related stress, significant family dynamics, include parental and martial separation, financial pressure, social isolation, and the lingering effects of past trauma. These factors collectively contribute to her present issues of anxiety, focus difficulties, and low self-esteem, as well as the observed behavioral changes in her children. Medical history, mental health, and hospitalization. Uh, she is concerned about her children's well-being and development, socio-emotional factors, financial history from being the sole provider, feeling of isolation due to lack support, and the potential unprocessed childhood trauma. Unprocessed childhood trauma, as briefly suggested, are significant underlying factors contributing to her anxiety and self-esteem. Impact on counseling. This counseling approach needs to be multifaceted, acknowledging the interconnectedness of these stressors, addressing their anxieties, improving her focus, and rebuilding her self-esteem will require strategies that consider her professional pressure, family responsibility, financial concerns, and emotional histories. No specific patient pertinent medical history, mental health history, or hospitalization are detailed in the profile field. The suggest that her current presentation may be new onset escalation of symptoms rather than recurrence of diagnosis of a mental illness. Isabel has a history of childhood trauma that has not fully processed. The significant factors that likely underpins or exacerbates her current anxiety, low self-esteem, and difficulties with emotional regulation and focus. The absence of any indications of currently occurring abuse is positive. Legal history. No self-reported history of legal problems, including any currently ongoing issues. This simplifies the case by removing potential legal entanglements as a complicating factor. Educational history. Isabel is currently employed as a project manager In high stress environments, her educational background is not specified, but her current role suggests a certain level of achievement and responsibility. The missed deadline are direct threat of this employment. Family of origin and current family composition functional. Isabel family of origin includes her parents with whom integrates her current family consists of herself and two children. Their family function is currently strict due to father's absence and the children behavior changes. The disagreement from her parents suggests lack of a traditional family support network. Community agencies, community no past current involvement, community agency reported. Cultural and factories. Cultural factories. Isabel Carr's social support system is primarily composed of her two children. Her relationship with her parents is strained due to past disagreements, and her relationship with her brother is distant. While she has a few work friends, the demanding nature of her job and her anxiety limits her ability to cultivate these relationships into a strong support network. She feels isolated and misses the sense of community she experienced it before her divorce. Identification with marginalized, vulnerable, oppressed groups. Latina female. As a Latina female, Isabel may face systemic barriers and biases in areas such as employment, healthcare, and education, which can exacerbate her stress and feelings vulnerability. Single mother, being single mother, especially with limited financial resources, places her in vulnerable position, facing significant challenges in balance, work, childcare, and personal well-being, mental health stigma, depending on her cultural background and community. Isabel may also feel like weight of mental health stigma, making it harder to openly discuss her struggles or seek help. Personal spiritual resource development stage at 32, Isabel is likely in the generative FC stagnation stage of psychological development, focusing on raising her children and career. Her current struggle could hinder her ability to feel productive and contributing spiritual and existential support. Isabel believes in God but has disengaged from religious practice due to disagreements with her parents. This indicates a past spiritual connection that's currently dormant, potentially leaving a void in her existential support system. Her internal belief in God remains, which could a resource to tap into inside. Isabel demonstrates a good level of insight into her situation. She recognizes her anxiety, focus issues, and low self-esteem are impacting her work and personal life. She also understands the connection between her stress and physical symptoms, raising her chest pain, judgment. Her judgment appears soon in seeking voluntarily counseling, indicating an awarenesses of the need of professional help. Motivation to participate. Isabel is motivated to participate in change as she is seeking service voluntarily due to the stress in her work and home life. Her proactive step of scheduling an intake appointment suggests her desire for improvement, personal strength, resilience. Despite significant stressors, she is functioning as a single parent and project manager. She self-awareness. She can articulate her struggles and their perceived causes. So parental dedication is her concern for her children, drawing indicating a strong commitment to their well-being. Spiritual beliefs, her underlying beliefs in God can serve as foundation for exploring existential or spiritual coping mechanisms. Motivation for change, her voluntary seeking for service is a key strength. formulation. So, psychosocial summary, Isabel is 82-year-old Latina female presenting with symptoms of anxiety and difficult focusing, caring her professional life and leading a physical manifestation of stress. Her current function is significantly influenced by a complex interplay of biopsychosocial factors. Developmentally, she is navigating the challenges of a young adulthood, balancing career demands with a single parenting. Her children's developmental stage and their observed withdrawal and disruptive behavior are significant concern and likely a source of stress. For Isabel, theoretically a psychodynamic perspective might explore the impact of her mother's past mental health struggles and her father's dismissal, suggesting potential intergenerational parent and early childhood experience affecting her current anxiety. A cognitive behavioral approach will be highest relevant given her reported anxiety, focus issues, and the physical symptoms linked to stress. Interventions could target her thought patterns and behavior contributing to her distress. A family system's perspective is crucial, highlighting the impact of marital separation, the absence of the children's father and grandparents, and her strained relationship with her brother in the family unit. Person environment BI model is highly applicable as Isabel's challenges are clearly a result of the interaction between her internal state, anxiety, low self-esteem, and her environmental circumstances, high stress, jobs, single parenthood, limited social support, family estrangement. Family issues are central to Isabel's distress, including her divorce, full custody of her children, estrangement from her parents, and strained relationship with her brother. These relationship dynamics contribute to her isolation and her children. That was it. Thanks so much for listening. Have a wonderful day.